We all know the statistics, but I'm going to give them to you anyways because they're grim. Since 1999, the cost of a family private insurance policy has gone up 119%. The typical family, either through lower wages or directly in premiums, pays about $12,600 a year on health care. So in healthcare reform, we've got to find a way to get to the root cause of why healthcare spending is rising. We can come back to that, but it really deals with the absolute explosion in chronic disease prevalence that's fueled by a doubling of obesity in this country. And secondly, the fact that 3/4 of our total healthcare bill is linked to chronically ill patients, that particularly in the Medicare program, we do a very poor job of managing. So we'll have to come back and deal with that. There are certain costs, as we've talked about, associated with employer-based health insurance that are less apparent than we see in the frequent tallies of spending. I'm going to focus on two of them. First are the costs associated with uncompensated care that's not directly paid for through federal or state sources. And second are the costs that employers bear who offer insurance for providing coverage to workers they don't employ, the spouses of their employees. In 2008, the last year we had data, for the 47 million people who don't have coverage, they incurred expenditures of over $57 billion. So we are paying through different sources and different arrangements for the health care bills of the uninsured today. This is a very fragmented, very unorganized, in a very uncoordinated way. When they can, hospitals and physicians shift the costs of these dollars that aren't explicitly paid for onto the costs of private insurers. This differential pricing is seen as a rational market response to the ability and willingness of some payers to pay more than others, similar to what you find in the airline and hotel industries. But regardless of what we call it, it's clear that private insurers pay more for health care and that these higher payments are used by providers to defray the cost of care for other patients, particularly the uninsured. On its most recent report to Congress, MedPAC reported that the average Medicare and Medicaid margins are projected to fall. This shortfall is made up for what MedPAC characterizes as unusually high hospital margins on private payer patients. That is, a private insurance plan on average pays about 20% more than the cost of care in order to offset the losses that hospitals and healthcare providers face from underpayments in Medicaid and from non-payments from the uninsured. There's a second significant cost shift to employers in providing health insurance, however, that's even more opaque than the cost of uncompensated care. And that's the cost of providing health insurance to spouses. Nationally, 51% of people under the age of 65 with private health insurance are covered through their own employer. Another 10% directly purchase private insurance, and the remaining 39% of individuals with private health insurance get coverage through their spouse and their spouse's employer. It's this last category I want to focus on. In 2006, there were 31 million families in which both adults worked. An analysis I conducted at Emory showed that more than half of those families, 55%, received health insurance coverage through one but not the other employer. Nationally, the cost of workers receiving health insurance through their spouses amounted to an increase of $46 billion in payments from employers that do offer health insurance. Employers who don't offer health insurance, for a variety of reasons that we can all understand, are called by some free riders because at least some of their workers get coverage via a spouse's employer. As we've heard, many small employers would love to have health insurance. It's oftentimes just very expensive and not affordable to do so. And so we need to find ways to make health care less expensive. Well, what are the costs of these free riders to businesses that offer insurance today? I already mentioned the one figure of $46 billion. Another way to think about it is that the incremental cost to employers that offer insurance of covering employees that are in firms that largely don't offer coverage is about $2,800 a year. So if you think about it, the rise in the number of dual working families combined with a decline in the share of employers offering health insurance is placing continued financial pressure on employers that continue to want to stay in the game. So we really have three problems in closing. One, we got to get to the fundamentals and find ways to make health insurance less expensive for everybody. And two, we've got to deal with the fact that we're doubling and tripling up on employers that offer health insurance, both through cost shifting from the uninsured underpayments on the Medicaid side, and by the fact that employers that do offer insurance are paying for the costs of those workers that don't offer insurance. In closing, thank you for inviting me to testify.